Assalamualaikum warahmatullahi wabarakatuh. I am Ayih Siti Nurhasanah and I am from 6th semester of English for Medic class, and now I want to tell about the kidney stone disease. So, what is kidney stone disease? Kidney stone disease, or the medical term is nephrolithiasis, is a condition of the formation of solid and hard matter that resemble stones in the kidneys. And then the stones come from the salt and minerals in the kidneys. So this whole problem can appear along the urinary tract. Kidney stones appear because walls in the blood from crystal and accumulate in the kidneys. Chemical that can form stones and clog the kidney ducts are oxalic acid and calcium. Over time, both substances can get harder to like rock. And in addition, once formed or solidified, stones can settle in the kidneys or travel toward the urinary tract. But sometimes small stones can pass through the urine without using pain. However, stones that are too large and interfere with urine reservoirs in the kidneys, ureter, bladder, and urethra. So this is the causes of the pain. Second topic is causes of kidney stone disease. So kidney stone form when urine contains more crystal and forming substances such as calcium, oxalate, and uric acid. So making it difficult to be destroyed by fluid in the urine. At the same time, urine may lack substances that prevent crystal from sticking together, thus creating an ideal place for the formation of kidney stones. The next is risk factors of kidney stone disease. There are a number of factors that can increase a person's risk of developing kidney stone disease, including the first one is family and medical history, and the second is age, because most kidney stone disease occur in people with an age range between 30 to 50 years. And then the third is dehydration. So people with not drinking enough water every day can increase the risk of kidney stone. And then the fourth is excess salt intake. People eating food that are high in sodium or salt can increase the risk of some type of kidney stone. And then the fifth is obesity. A high body mass index or BMI, large waist size, and weight, inflammatory bowel disease or chronic diarrhea can cause change in the digestive process. And then the other factors is other medical condition, for example, kidney tubular acidosis, cystinuria, hyperparathyroidism, and recurrent urinary tract infection. So all other medical conditions can also increase the risk of kidney stones. Last factors is certain supplement and medication. For example, vitamin C or laxatives, when used in excess, can increase the risk of kidney stones. So, and then the next is type of kidney stones. The type of kidney stones, the first one is calcium stones. Most kidney stones that occur due to calcium stone, usually in the form of calcium oxalate. And then the second is trophied stones. when strophyte stone can also form in the response to urinary tract infection. And then the next is uric acid stones. Uric acid stone can form in the people to lose too much fluid. And then the last is cystine stone. When this stone form in the people with a hereditary disorder called cystinuria that causes the kidneys to extract too much of the certain amino acid. Okay, and then the next is symptoms of kidney stone disease. People with kidney stones may experience the following symptoms. The first one is severe and sharp pain on the side and back, under the ribs. And then the second is pain radiating to the lower abdomen and groin. And then the third one is the pain that comes in waves and its intensity fluctuates. And then the last one is pain or burning sensation when urinating. Then diagnosis of kidney stone. So to diagnose kidney stone, the doctor will conduct a medical interview related to symptoms, medical history, and drug that are currently consumed by kidney stones. And then the doctor will perform a physical examination, such as examining of the lower abdomen and waist or groin that feels pain. After that, to support the diagnosis, the doctor will also perform further tests such as urine test, blood test, scanning including the X-ray, ultrasound, and then CT scan. Because examination useful for determining kidney stones. And then the last is analyzing of kidney stone that come out. So this examination is useful for determining the cause and treatment plan. So the doctor will perform this test by analyzing the type of kidney stone and come out with urine. Okay, the next is kidney stone treatment. So treatment of kidney stone will vary in each person because treatment will depend on the type of kidney stone and severity of symptoms. For small kidney stones, doctor will advise people with this condition to drink 6 to 8 glasses of water a day to increase urine flow. In addition, people with kidney stone who are severely dehydrated may need intravenous fluids. So other treatment option use the doctor if to treatment the patient is the first one, medicine consumption, and then the second one is extracorporeal shock wave lithotripsy or ESWL, where ESWL is a procedure to break kidney stone into smaller ones using shock waves. And then the third one is percutaneous nephrolithotomy, where a surgeon removes the stone through a small incision on the back. And then the last treatment is ureteroscopy. When the stone ureteroscopy is used when the stone gets stuck in the ureter or bladder. So the doctor will use a ureteroscope to remove it. And then the last topic in this disease is food that should not be consumed by people with kidney stone. So there are a number of food that people with kidney stone need, such as salt intake, and then limiting animal protein intake, and then oxalate, and then the last is food and beverage with added sugar. So I think that's enough of my explanation about the kidney stone disease. So stay healthy and eat healthy food. So if necessary, always check your healthy to the doctor. Okay, I think that's enough for me. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.